Welcome to this audio guide for talking head pain, produced by the Global Healthy Living Foundation. Whether you or someone you care about have migraine, or think you or they might have migraine, these audio guides are designed to help you make sense of the headache and other symptoms. Accurate information will help you work together with your healthcare professionals to hopefully have fewer and less severe headache episodes. Please remember that headache of any kind is a medical issue, and always talk to your healthcare team if you have a headache that bothers or worries you. In this audio guide, we discuss getting headache disorders diagnosed so they can be properly treated. In every audio guide, we provide information checked by medical professionals specializing in the treatment of migraine and other headaches, and other people who have migraine and understand what it is like to live with recurring headaches. Suggestions for care are based on guidelines from the American Academy of Neurology and the American Headache Society. Almost everyone will have a headache a few times in their lives. Often, these are symptoms of another illness. But when headaches keep happening in the absence of other illness, it may be a headache disorder. Getting headaches regularly is not something to brush off, or let others brush off for you. Repeat headaches from any causes, migraine, injury, or anything else, are a medical problem that can be treated, and anyone with regular headaches of any kind deserves relief. Why should you get a diagnosis? Getting a specific diagnosis for whatever is causing repeat headaches is an opportunity to find the best treatments for you. Different headache disorders respond to different medications, and each person responds better to some medications than others. It is also important to know that misdiagnosis of headache disorders is not uncommon. Many people with migraine, for example, are told they are having headaches from allergies or sinus conditions. If your physician is not paying attention to the more subtle signs of specific headache disorders, like eye tearing, neck and shoulder pain, scalp tingling, light sensitivity, or nausea, they may be mistaking one headache disorder for another or think the headache is caused by an unrelated problem. That's a missed opportunity to get better, more effective treatment and to stop using and paying for treatments that are not working for you. Let's talk about access to healthcare. Before talking about getting your headache disorder diagnosed, we want to acknowledge that for many people, this is limited by poor access to healthcare or poor treatment within the healthcare system. In the United States, many people do not have insurance or cannot afford to see a doctor. If this is the case for you, we hope that these audio guides will provide at least some useful information that you can still use to care for yourself, because you matter. We also recognize that structural racism and discrimination occur within the healthcare system, and this can make it more difficult for Black people and members of other marginalized groups to make use of the information we are sharing. We know studies have shown Black people are less likely to receive appropriate diagnosis or treatment for migraine headaches in emergency rooms, and are also more likely to be perceived as a so-called difficult patient if they self-advocate for proper care. Although no profession or individual is immune from bias, there are healthcare providers working to change this. We encourage you to continue educating and advocating for yourself and others. Finding a physician who welcomes this may be the first step on your journey to improving your headache condition. Many people with chronic conditions of any kind also find networking with others who have the same health condition and advocacy can help fight stigma and isolation. You may feel you do not have a lot of time or energy to do this, and that is okay. If you do want to explore this further, we have resources available at ghlf.org. If you can, how do you get started? If you have a regular healthcare provider, talking to them about your headache episodes is a great first step. Let them know as much as you can about your headache attacks. In Audio Guide 1, we talked about keeping a migraine diary that includes when and where pain occurs, what, if any, other symptoms come with before, during, and after, how long your symptoms last, if symptoms affect your day-to-day activities, what medications you have tried and whether those help, any other medications you take, and any other consistent patterns you see. Sharing your migraine diary with a healthcare professional can give them a very clear pattern that they may be able to connect to specific headache disorders. Together, you and your healthcare team may be able to identify a likely cause of your headache episodes and treatment options to try. You may also decide to consult a neurologist or headache specialist. Neurologists specialize in brain and nerve conditions, including migraine and headaches. Headache specialists have completed specialized training for diagnosing and treating headache disorders. If you live in an area where neurologists or headache specialists are not available, You may be able to have a telemedicine appointment with one, or may be referred to a pain management specialist. The American Migraine Foundation and the National Headache Foundation offer lists of healthcare providers who are experienced in treating migraine and other headache conditions. You can visit their websites, AmericanMigraineFoundation.org or headaches.org. How are headache disorders diagnosed? At this time, there is no blood test, X-ray, or MRI study or procedure, such as taking a person's blood pressure, that can objectively determine if a person has a headache disorder or what kind of headache disorder they may have. Headache disorders are diagnosed clinically, by recognizing patterns common to specific disorders and by making sure something that can be tested objectively is not the cause. Your healthcare provider, whether they are your primary care doctor, a community healthcare person, a neurologist, or a headache specialist, will first want to know more about your headache episodes. As we've mentioned, having a headache diary to share can make this process easier, and your healthcare professional may still want to ask more questions or for more details. The first step in diagnosis is understanding your unique pattern of headaches. How does the pain feel to you? Is it a dull ache that worsens into throbbing pain or a sensation of being stabbed? How intense or difficult to tolerate is your pain, often on a 0 to 10 pain scale? Does the pain worsen with movement? Where on your head does pain occur? Behind one or both eyes? At the front or back of the head? With neck and shoulder pain? Do other symptoms come right before, during, or after the headache? For example, changes in vision or other senses, nausea or vomiting, sensitivity to lights, sounds, or smells, dizziness or feeling weak or numb, difficulty thinking or speech changes, balance issues? How long do your symptoms last, from first signs until being able to return to normal activities? How often do you have headache episodes? Every few months, weeks, or days? How many days each week or month do you have no pain or discomfort? Do your symptoms interfere with sleep, work, household chores, exercise, leisure activities? Do your symptoms only occur in some environments, such as at your work site, and not others? Your doctor may also ask whether you've noticed any stressors, foods, drinks, activities, weather conditions, odors, or any other factors that seem to set off your attacks. Both to recognize patterns in your headache episodes and to determine other illnesses are not the cause, it is important to discuss you and your family's medical history. This includes high blood pressure, heart conditions, or strokes, epilepsy, depression, anxiety, or panic attacks, asthma, anemia, or diabetes, chronic pain, fibromyalgia, neck and shoulder pain, surgeries, injuries, and other conditions. It is also important to discuss prescription and over-the-counter medications you use, as well as other substances, including alcohol, cigarettes, and caffeinated beverages like tea, coffee, sodas, or energy drinks. All of these can cause or worsen headaches and associated symptoms. To make sure another condition is not the cause of your headaches, it is likely that your doctor will want to do a blood test to rule out thyroid problems, diabetes, infections, or exposure to toxins. Depending on your age or overall health, a CT scan or MRI on your head and neck may be ordered to check for any problems with blood vessels or the presence of any growths or tumors, although these are rarely found. Usually, imaging studies are done only if your headaches begin after age 40 or if your headache pattern has changed. Although uncommon, if you have other signs of infection or nervous system, your doctor may also want to take a sample of your spinal fluid to evaluate. Is it migraine? Migraine is, by far, the most common cause of recurring headaches. If other problems have been ruled out and you have had 5 or more headaches that were at least 4 hours long and came with nausea or vomiting or sensitivity to light or sound, migraine may be diagnosed. The good news is that there are more specific, effective, and safe medications to treat migraine than ever before. You can learn more about these in our Migraine Medication Options audio guide. If you already use medication, or are not wanting to try that route just yet, you can learn more in our Non-Medical Therapies audio guide. We also discuss more practices of everyday life in our Managing Migraine in the Workplace audio guide. If you are still unsure about the difference between migraine and headache, you can find out more about the differences in our What is Migraine audio guide. For medical information and advice about your own migraine treatment, speak to your doctor.